You're doing fine. You want to talk about this, Dave? I'm getting you back on there.
When the leg broke, I want to tell you, if you're going to break a leg, do it while you're passed out. What happened was, after my first 2 weeks of interleukin treatment, I was home. I was actually back at work. And I got up at 5 o'clock one morning to go to the bathroom. My head felt light. I called to my wife, and I passed out. And when I woke up, my thigh was shaped like this. But, you know, if you're going to break your leg, do it while you're passed out. And then don't wake up until you're in shock. And then the shock lasted until the medics got there and filled me with morphine. The only fun was the ambulance ride from New Hampshire down to Beth Israel Deaconess on 93. You know, we actually came up with a Lamaze style thing. Like the driver would say, "Here comes another one." I'd go and get through it. But I had marvelous carpentry done. I have this nice steel leg. But at one point, the wound got infected. This isn't the greatest thing, but this is a glorious example of telemedicine here. Because my wife took the digital camera and, you know, with her veterinary skills, says, "Looks infected to me." And we emailed it to the doctor.
But you were implying that she wasn't really a professional photographer.
Right. But she, and the doctor said, "Yep, no need to come down to the hospital. Go ahead and take those antibiotics that you've got a prescription for." Oh, she sent the okay.
Prescribed.
Good. Thanks.
So I hope you're getting a sense about this. I mean, this was an incredible journey that we went through. And to some extent, we're still going through. And the idea is, I'm trying, well, I guess I show you this follow-up picture. This is a follow-up scan. The scan we saw before is on the left. And 50 weeks later, after therapy, you can see that this lesion is almost not there. So thank God, Dave wouldn't be here with me if this had not been successful. He was very lucky. And we're not here to talk about the virtues of the therapy, although it is very good. What we're really here to talk about is share with you the impact that connected information technology had on the whole experience of illness for both Dave, we're all thinking about Dave, but also on me. I mean, it meant a lot to me to be part of this whole thing and to really be a partner with Dave in this. I mean, it's really a huge thing. So that's what we really wanted to tell you today. And we drew some conclusions from it. And I'll start with the physician aspects of this. Physicians have not really gravitated to this technology. As physicians, we need to be more engaged with our patients, more participatory. We need to not be afraid of those uppity patients, those patients who are coming to us and bringing us things from the internet and so on. We really need to engage them. I realize I'm preaching to the choir. You wouldn't be here if you didn't believe that. But unfortunately, this is a field we have to change. And what we have to really help doctors to understand is that this isn't something that's just empowering the patients, but it's also empowering the physicians. We need to embrace the knowledge symmetry, the idea that, you know, you're a person and you have a lot of stake in this and you're smart and you can be a partner in your care. I don't have to know everything and you know nothing. We can actually come together and have some of the same knowledge. And rather than feeling threatened about this, I need to feel relieved because, God, I don't have to know everything or pretend I know everything. We need to provide services to our patients. That's a lot of what this conference is about, right? We need to provide the kind of services that we have at Beth Israel, at Partners, and other places where some of you work. We need to encourage patients to use their online connections. I mean, I think that, and Dave once said to me, he said a couple things that I think are important, and I want to mention them because I don't think we mentioned them so far. So Dave said a couple things. One thing he said to me towards the end, towards the end of the therapy, he said, probably the most important advice you gave me was to reach out to find an online community through ACOR. The other thing Dave said, which I think was quite powerful and speaks to the power of this technology, and we could not find the email record of this. I think that it was something you said to me on the phone. After Dave became engrossed in his therapy and his treatments in the community, online community, he said to me, I've been in contact with 100 patients, maybe more, other people who have been through the diagnosis of kidney cancer, my kind of cancer, all over the world. And so many of them, most of them in fact, give me stories about how cold and isolated and alone and just cut off from everything, from people, from information. Dave said to me, and it gave me chills just thinking about it, Dave said to me, I don't feel any of that. He said, I feel connected. I feel supported. I feel that I have access to the information and people aren't keeping it a secret from me. And that's the one lesson that I'm going to really take away from this, how important this was and what a difference it made to Dave. Dave?
Playing a participatory role. Being empowered does not make me an oncologist. Okay? But on the other hand, since I got involved with the ePatient Scholars Working Group that Danny and these people in the front row are member of, ePatients.net, magnificent website. There is a white paper on that site. It takes several hours to read through it, but if you haven't read it, please do. It is packed with research over the past 10 years of what the pioneers on the frontiers of what we're now calling participatory medicine have been doing to bring patients and information together. One example of that is in the ACOR community. Like there'd be somebody in Kansas who says, okay, I just got this diagnosis. My doctor says he took a course on kidney cancer 5 years ago, and so I'm fine. And they said, no, like everything. What I was able to do a year ago last week at the Kidney Cancer Association Patient Day in Boston, in Cambridge, after the opening, after the keynote, the question microphone happened to be next to my chair of all magnificent things, which was handy because my leg still wasn't working that well. And I was able to engage with the leading renal cell carcinoma oncologist in the Northeast in a discussion about the validity and relevance of the statistics that he'd been presenting, which he agreed are no longer relevant because they were all developed. It's the most recent peer-reviewed stuff, but they were all developed before any of today's treatments existed. And the other people who were sitting at my table there were scared half to death by what they were reading. I asked the ACOR people, where's the best doctor in the Northeast? Now, if they had said, you got to go to MD Anderson, I was going to do that. What was I going to do, sit in Boston and say, oh, darn? Right? But fortunately for me, it turns out the doctor that Danny had already gotten me hooked up with was like the guy. And it was his boss that I had this engagement with. Embrace knowledge symmetry. What I find as I talk to people here is an awful lot of patients. Please do what you can to teach people this. An awful lot of patients don't think they have anything to contribute. And one thing that's well documented in the ePatients white paper is that today, doctors are flooded with new information. There is no way anybody can keep up. And when you combine that with the financial stresses, the time limits on every visit, they have no ability to go deep. So just deal with the fact that, yeah, you do have something to contribute. Find and use online services. One of the things that we need to do in the ePatients group is to develop a list. Because every couple of weeks, somebody who's heard my story comes to me and says, what do I do now? I got a diagnosis. We need a list of those. Learn how to filter out the good from the garbage. If you're completely new to this, well, you know, anybody who's new to email, there aren't many left, but there were in the last 10 years, learns that every time they get an email about Andy Rooney says blah, blah, blah about America, that doesn't mean he actually said that. And the same's true with medical information. If you're new to this, the fastest way to do that, in my experience, is a peer community that can say, yeah, don't believe that stuff. Interestingly enough, that applies not just to flaky, quacky suggestions, but stuff from well-established websites also.
And this is something that we as doctors and health professionals can help our patients with. So giving them a start on where to go to websites and teaching them a few features of good websites versus bad websites. Don't be afraid of this.
Right.